Hey,
We all made
welcome. Lee. You're here, Gwen.
and Sam, there she
Anna's here as well. Excellent. We all made it, and people are just coming in. So we are going to actually just kick off right away. Thank you all so much for joining us. My name is Lizzie. I am a part of the team at Journey Clinical, and we're really happy that you made it here this evening for this conversation about psychedelic therapy. This past Saturday was World Psychedelic Day, which is a day dedicated to expanding awareness about psychedelics and mental health. And so, in honor of this day, we decided to offer this conversation this evening for folks who are maybe outside of this field, who want to understand the landscape of what's available and legal when it comes to psychedelic therapy in the US. So this has become a buzzword and a kind of topic that obviously piqued your interest if you're here this evening, maybe from a podcast or something you read or a friend, or maybe you know somebody who has personally experienced treatment. So tonight we're going to cover the landscape, broadly, what's available right now, and what treatment actually looks like for someone who decides that this might be right for them or someone that they love. So we have some slides for you that will guide us through this conversation. Get my screen shared. Okay, here we go. So we're going to give an overview of psychedelic therapy. We're going to talk about the eligibility and some FAQs. We're going to talk about how to get started, and then hopefully we'll have some time at the end for a Q&A. So there's a Q&A section here on Zoom where you can submit your questions. And if we don't get to them right here on the call, then we will have those questions and we'll send out some answers to you asynchronously. So as we move through the conversation, you'll hear from some of the professionals that you see here on the screen, which includes medical professionals and therapists who help deliver care, and some members of the Journey Clinical team who are obviously our hosts for this evening and who we're affiliated with. So Journey Clinical is the largest psychedelic-assisted psychotherapy platform in the US. We have a network of over 3,000 licensed psychotherapists across approximately 30 states. And our clinicians have delivered over 1 million hours of ketamine-assisted psychotherapy, which you're going to learn a little bit more about this evening, to thousands of patients, tens of thousands of patients. And we help patients address the root causes of depression, anxiety with insurance-covered ketamine-assisted psychotherapy, as I mentioned, SPRAVATO, which you'll hear more about, and as well as comprehensive medication management. And 87% of our patients report measurable improvement in their clinical scales on depression and anxiety scores, for example, and 40% report full remission. So we're really proud of these outcomes. This data represents tens of thousands of humans whose symptoms have improved from this treatment. And hopefully today you'll get a little bit more of an understanding of what that looks like. So I want to start with some history and some broad information, really, really big picture stuff here. So I want to start with the etymology of the word psychedelic, which if you're a therapist, you may have heard this in some of your trainings. It's oftentimes where trainings begin, which is that psychedelic actually at its root means mind manifesting. And so the word psychedelic was coined in the 1950s, and it refers to a class of psychoactive substances. So many of them you may have heard of. They include things like psilocybin, otherwise known sometimes as colloquially as magic mushrooms, LSD. And these substances profoundly alter perception, mood, and cognitive processes by inducing non-ordinary states of consciousness. And what's important to state is that what we now classify as psychedelics have actually been used in healing contexts for thousands of years. So psilocybin mushrooms, for example, were used by indigenous communities in Mesoamerica going back generations, and they were actually used in structural ritual contexts to help people process things like grief, trauma, and spiritual crisis. So this therapeutic container that we're also going to be talking about tonight is also not at all a modern invention. But today we have the tools to study their safety and efficacy and expand access to these treatments through legal health systems and things like insurance coverage, which are really exciting to expand access to folks. So to continue with the history, by the 1960s, there were actually over 1,000 published studies on psychedelics, things like psychedelics and alcoholism, end of life, anxiety, depression. And then in 1970, there was a Controlled Substances Act, which put a lot of this psychedelic research on hold and a lot of funding stopped. It picked back up again in the late 1990s and early 2000s. Some of the major research organizations that pushed forward some of this research were Johns Hopkins, NYU, Imperial College in London, and they began getting approval to study psilocybin and psychedelics again. Actually, around the same time, ketamine, which is technically a dissociative anesthetic, and this has actually been FDA approved as a general aesthetic since 1970, began being studied for its mental health benefits. Ketamine, while not being a classical psychedelic, also induces a non-ordinary state of consciousness. So when it's being used for health, it kind of falls under this umbrella that we'll talk about today of psychedelic-assisted psychotherapy. Something that's important to clarify is that while some psychedelics are being studied as standalone treatments for mental health, they're also being studied in the context of psychotherapy. And so that's really important to what we're going to talk about today. Psychedelic-assisted psychotherapy is really at the center of what Journey Clinical offers. Our model is built around this network that we have of thousands of therapists so that you can access psychedelic treatment not just as a standalone, but with the support of a licensed mental health professional. So defining psychedelic-assisted psychotherapy is the conjunction of using psychedelics combined with psychotherapy for the treatment. And evidence suggests that this therapeutic container or working with a therapist to help you process the insights or experiences of the psychedelic treatment can make a really big impact on your long-term clinical outcomes. So you'll hear us use this term, psychedelic-assisted psychotherapy or ketamine-assisted psychotherapy, throughout the evening. And researchers are still exploring exactly how and why these treatments can be effective. So each psychedelic that we'll talk about today has its own pharmacology and its own effects on the brain. But generally, and Sam can speak more to this, but these compounds quiet the default mode network, which is your kind of brain's autopilot. So often it's associated with rumination or rigid thinking patterns. And what they also do is create a window of neurological flexibility, otherwise known as neuroplasticity, where patients can access or process material that they've been stuck on. So in some cases for years, and maybe Gwen will be able to speak a little bit more about clients and how this has opened up a window for them in therapy. So today there are hundreds of psychedelic clinical trials, and research is more rigorous than ever before, and it's also more connected to the clinical infrastructure that's needed to actually deliver these treatments at scale legally to people across the country. And that includes both people that live in major cities or those who are in rural areas. We want to think about how we can actually expand and scale access, and that's really what brings me back to Journey Clinical. So Journey Clinical has built this infrastructure for millions of Americans to be able to access legal psychedelic medicine. So as access grows through this model, we're positioned as America's gateway to legal psychedelics in many ways. And so that leads me to introduce to you someone very special that we have with us this evening. Who better to share about the landscape than our co-founder and CEO, Miriam Bart. So Miriam, I'm really glad for you to be here today. If you wanted to share a quick, short introduction of who you are, then I have some questions for you. Thanks for being here.
Thank you, Lizzie. Thank you so much. Quick introduction. So my name is Miriam. I'm the co-founder and CEO of Journey Clinical. We have started to build this company in 2021 in our living room when COVID hit. And then we have since grown to become the largest provider of psychedelic-assisted psychotherapy in America. And as Lizzie mentioned, we have 3,000 incredible therapists in our network. We have an incredible medical team. Thank you, Sam, for being here. We offer insurance coverage, and we have done over 1 million hours of ketamine-assisted psychotherapy. So what I think is important that everybody knows is we are ready. We have been doing this work for the last 4 years or 5 years at this point to incorporate new psychedelic medicines as they receive FDA approval.
Amazing. Thank you. Thank you so much, Miriam. My first question for you is about, as you mentioned, we're already actively doing this. So can you share a little bit more about what some of the psychedelic therapy options that Americans can actually legally access today?
Of course. So I would encourage us to think about there are three ways that people can access psychedelic therapy today. There is the FDA pathway. And so the FDA pathway means you can have access to ketamine, which has been FDA approved in the 70s and has been used off label through various routes of administration, as well as SPRAVATO, which is a ketamine derivative that was FDA approved for treatment resistant in 2019 by Johnson. And what is really interesting about SPRAVATO, it's actually the first drug for treatment-resistant depression. And there are millions of people suffering from depression that really need access to these treatments. So on the FDA pathway, which is what Journey Clinical support, we have ketamine and ketamine derivative. The second way to access psychedelics today in America is psilocybin through state licensed psilocybin therapy in Oregon and Colorado. What is important to note here, these are the only places you need to go, and you need to travel there. You can't be in other states and have access to psilocybin legally in America today in the psychotherapy context. There is, of course, some decriminalization efforts that have been made, but this is different from regulated therapy. And then the third way is through clinical trials. As Lizzie mentions, there are over 100 clinical trials for psychedelic drugs, many of them in phase 2 and phase 3 clinical trials. That means pretty advanced, including psilocybin, MDMA, LSD, DMT, DMT-related compounds, ibogaine, which a lot of people have been talking about in more recent days. And so today in America, this is how you can legally access psychedelics. What is so important to say, and I added this note at the bottom of the slide, is you need to be eligible for the treatment. You need to be seen by a medical professional, and the medical professional, and we have Sam here to help us with that, this is the person that can help you assess if this treatment is a fit for you or if it's not. And there's some real benefits and some real contraindication, and both are really important to take into consideration when you think about these treatments.
Thank you, Miriam. That's very important to emphasize, and we'll emphasize that again throughout this conversation. So this is what's currently available. Can you, as the leader of this organization, give us any information into what might be on the horizon in terms of access? So I know you mentioned there are some treatments in these phase 2 and 3 clinical trials. What might be available in the future, in the near future, for psychedelic therapy?
So, the most obvious one, as everybody knows, and I know this is not the slide, we can go back to this after, but really the most obvious one is, so we had the executive order in April from the White House. Then following that, we had the FDA issuing vouchers to 3 companies for accelerated review of their compounds. Those 3 companies are Compass Pathways, Usona, and Transcend. And Compass Pathways is the further advanced in the FDA pipeline. They are in phase 3 clinical trials. They have published multiple times about their results. And so what is interesting about the changes to the FDA review timeline is that prior to the voucher, FDA review could take 6 to 10 months, and now they're being accelerated to a 1 to 2 months period. So that means that once Compass Pathways submit an application for FDA approval, then the FDA will take about 1 to 2 months for review. That means, hopefully we're looking at an FDA approval or like late 2026, early 2027. This is the timeline that we're currently looking at. Of course, commercialization always takes a little bit of time, but I think at Journey Clinical, we're very excited and looking forward to introducing psilocybin as part of what we offer to both clinicians as well as patients, so that people, and that is the question on everyone's minds, like, how are we going to access these treatments once they're FDA approved? And Journey Clinical is the place. We are equipped and Gwen and Sam will talk about it more very, very practically. So very exciting times for psychedelic in 2026. And we have had, thank you, as the slide says, since 2024, we've had this partnership with Compass Pathways. And so we are very close to their team and to thinking through care delivery and insurance codes and monitoring and who's going to be in the room, all the practical questions that are on everyone's mind, we are actively working through them through our research collaboration.
Yeah. Thank you so much, Miriam. Thank you for that information about what's going to be available. We want to dive into some of the frequently asked questions about these treatments with Gwen and Sam. So we're going to do some psychedelic FAQs with these two. They represent two sides of what is necessary in order to access and deliver these treatments, which is a medical provider, which Sam represents as a part of Journey Clinical's medical team, who do the eligibility assessments and the prescribing for CAP. For psychedelic assisted psychotherapy, and Gwen, who is a therapist in private practice who actually directly supports the clients through the experience of the treatment. And we're going to learn a bit more about what that looks like in just a moment. So the questions that we're going to cover with them are about the difference between psilocybin and ketamine, about what is microdosing. This is a frequently asked question we get. Who is eligible? Question about SSRIs. What actually happens in treatment? We're going to clarify a little bit about what SPRAVATO treatment is. And then we're going to talk about how to choose a psychedelic therapist and how to get started. Then we'll loop Will into that conversation after that. But before we get started with this, I want to offer to Gwen and Sam just to give a brief introduction of yourselves before you start helping us clarify all these questions. I also want to give a shout out. It is Gwen's birthday today. So we're very, very lucky that she's joined us to educate us all on this special day. So if you want to kick off, Gwen, birthday person. You are on mute, Gwen.
Thank you so much. Thank you, Lizzie. And thank you all. I'm really excited to be here. I can't imagine being anywhere else on my birthday. And this is truly, genuinely what I am passionate about as not only a multi-licensed psychotherapist and certified psychedelic assisted therapy provider, but really also as an educator and advocate for psychedelics as a healing course of personal growth, development, and there's so many other ways that I see this as an ally. And so learning about how to do it safely and legally and within our system is something that I am always finding myself talking about. It's very interesting and curious, and also can be quite confusing because it's so popular now, even though, as you said, Lizzie, it's not new. It's been something that has been explored all over the world for thousands of years. But these conversations are something that I very much appreciate. So I'm happy to share experiences with clients as well as trainings that will cover a lot of these questions in even just teaching and mentoring my own colleagues and clinicians I work with my group practice, Rooted Ethos, and any other areas that I can shine a light on and provide resources for.
Thank you, Gwen. Thanks for being here. Happy birthday. Go ahead, Sam.
Hi, everyone. My name is Sam. I am a psychiatric and primary care nurse practitioner. I've been with Journey Clinical for about 2 years now and working in the CAP space, ketamine-assisted psychotherapy space, for about 5. And it's been, a really important piece of my own growth. And that's why I think it's been so important for me to share this treatment and education with other people so that they can find their own healing too. I'm licensed in Wisconsin and Ohio, so I see patients in those states. And I'm just really happy to be here and share this with you all.
Thank you, Sam, for being here as well. We're going to kick it off to you actually right away with this question about the difference between psilocybin and ketamine. Oftentimes people come in kind of being aware of psilocybin, sometimes before they're aware of ketamine, despite ketamine being in every hospital around the world and so often used medically. So I would love it if you could just clarify a little bit about these two compounds and how they differ, as well as what conditions they might be better suited for.
Mhm. Yeah, so as Lizzie mentioned earlier, ketamine is a dissociative anesthetic, so it has NMDA receptor antagonism. What's important about that is that it's different than psilocybin. So psilocybin is what falls under one of our classical psychedelics, and most of those work on serotonin receptors. So, two different receptor pathways. And so, what's interesting about psilocybin is that in some cases we have to take a peek at people's medications because a lot of our standard antidepressants do act on the serotonin receptors. So, in some cases, we may need to taper or look at somebody's medications to make sure that psilocybin can be delivered safely. And what's really nice about ketamine is that it actually, I like to say, it plays nice with most medications. So, generally speaking, we don't need to change much about, or really anything most of the time about people's medication. So, it tends to be a little bit more accessible in that way as far as who can access it if you're on other medications. But it doesn't disqualify you to work with psilocybin, but just something we have to take into consideration. So, another important piece is ketamine is a shorter experience, so roughly 1.5 to maybe a little over 2 hours. Psilocybin can be up to 8 hours, so very big difference in the time frame, which I think also makes ketamine a nice intro medicine. I like to say that when people are new to the psychedelic space, I'm like, oh, ketamine is like kind of a really great way to introduce yourself to a psychedelic space because you're in it for a shorter amount of time, and these medicines aren't, they're not for everybody, and sometimes you only know that once you try them. And so, approaching it from that, shorter experience, for some people that can be nicer. um Ketamine also has decades of clinical use. And so, like Lizzie mentioned, it's used in hospitals all over. It's used on kids, and it's been around since the 60s. Psilocybin, like as we know, has been around and has been used, but the research and evidence is newer, but it's really promising, which is exciting. And I think that was the whole question.
Thank you. Yeah, that really helps, especially thinking about those brain systems. And I wondered too, Gwen, I'm sure you get this question a lot from folks. And so could you share a little bit more about how you would explain it to clients, this difference, as well as maybe if you have any way that you would help explain to them what an experience might feel like on ketamine versus psilocybin?
Sure, absolutely. I think it's extremely important to clarify what you just went through, Sam. Thank you. In also really destigmatizing what ketamine is, because often I start with just wanting to know, what is your association to ketamine to begin with? Because even myself, I mean, being in New York and riding the subway system, my first initial association, transparently, was those K-hole advertisements, like trying to fearmonger around this club kind of drug, right? And so I think being very, very clear about its safety, as again you really laid out very clearly, how long this substance has been used in hospitals on babies, right? And also recognizing the dosage is something that I want to really highlight as very, 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 very different when it comes to psychedelic assisted therapy. The dosage is completely different, and the container and context are all so different. So I always want to know where someone is in terms of starting in association with the medicine, because ultimately, even though this is a synthetic medicine and it's also very, very different than indigenously used treatment medicines, we are still building a relationship with this medicine. Is something that how I work with the medicine and with clients. And so understanding what it is, how safe it is, and also what you're looking for is where I start to kind of facilitate answering this question around what they're looking for in a medicine. And I think another really great point that you highlighted, Sam, is specifically between ketamine and psilocybin, is that you don't need to stop a regimen of a psychotropic medication, an SSRI that you might be prescribed, even if, and this might lead into our next question, even if you are curious or maybe very adamant about tapering off of a psychotropic antidepressant, for example, medication, and seeking a way to do that with an ally like ketamine, for example, you can much more easily do that with ketamine than, for example, psilocybin, because of the mechanism of action and because of the way in which it interacts with your brain. So I always make sure to explain that too, just in terms of the receptivity and the flexibility of just the components and chemical compounds of the medicine and how it interacts. And again, it depends on what you're looking for there. Was there any other follow-up question I missed?
How do you approach it when a client asks you what the subjective experience, what it
Yes.
feels
So
like?
the experience itself, thank you. I thought there was something I missed. So I explain ketamine as a very inward experience, especially if it's a full dose journey. You are going inward. It's very different than other, as you said, classic psychedelics like psilocybin or MDMA, or even LSD, where I frame it as more external. You might want to move your body. You might want to dance. You might very well not want to do that on ketamine. It might actually, jokes aside, elicit dizziness or even nausea if you try to move too much in that way or express yourself in that way. Also, you probably just wouldn't want to. Again, this isn't a dissociative anesthetic in terms of the category. And so recognizing that your motor functioning is going to be affected. Typically what a journey, full dose journey looks like, especially in this context. People are wearing eye shades, kind of controlling the environment in that way. They're cuddled up and curled up in a comfortable place. Again, transparently, oftentimes my clients are in their bed. And especially with telehealth therapy and journeys in this way, they've got their laptop and they've placed me even next to them, and they're comfortable in this intimate space, curled up with their blankets, and they're inward in their journey. And so it might be very abstract imagery. It might incorporate themes or people or other thoughts that are more seemingly related to the preparation, and we'll get to preparation later. And that's also why integration is so important, to start to make sense of what came up in that inward journey, especially if it's more abstract. And so yeah, recognizing that it's an inward journey. There's a curated playlist as well that typically the trained psychedelic therapists will provide. So they've got their eye shades, maybe headphones, and they're curled up and they're just inward for that full 3-hour session, of which anywhere from 45 minutes to maybe if there's like a 30-minute, 40-minute prep to go over everything, sometimes the rest of that session is that inward journey.
Thank you so much, Gwen. Yeah, I think that's really helpful. And I think another thing to mention might be that ketamine is an intrinsic antidepressant. It has intrinsic antidepressant effects. And so, for instance, we have a whole webinar and training for therapists on navigating difficult experiences, which some people may come into this with some feelings or fear even around. And she discusses in there that ketamine journeys can skew towards positive based on the intrinsic antidepressant effects. In a way that may be compared with a psilocybin journey. So that's something that affects how people kind of experience the treatment as well.
Which also kind of piggybacks what you were saying, Sam, around it being maybe a more receptive experience, especially for someone who's curious.
Mm-hmm. Great. So we're going to move on to our next question, which is another kind of common question we get, which is about microdosing. So we oftentimes will have people say, oh, I've heard of psychedelic therapy. Isn't that like microdosing? And we want to clarify a little bit about what microdosing is and how it compares to what we're talking about. So if we can kick off with you, Sam, that would be great.
Yeah, so microdosing is quite different than sort of what we're offering with psychedelic assisted therapy, psychotherapy. Microdosing classically refers to an actually subperceptible, meaning you're not actually going to feel anything, you're not going to experience any psychedelic effects like sensory wise, typically with psilocybin or LSD. So again, no noticeable effect. This is often done like every other day or every couple days, not typically daily. And so currently the evidence is kind of mixed. We do have some placebo-controlled studies that suggest expectation may actually account for quite a bit of the reported benefit, but a lot of people do report benefits. So ketamine, in the way that we work with it, so we kind of work with full dissociative doses. That's sort of our standard of practice. We use weight-based dosing. We also offer psycholytic dosing. So where you're using a lower dose medicine where you're still going to feel the effects of the medicine. It's not that sub-therapeutic level, but a lower dose level where there may be some more interaction and you have a little bit more access. And there may be many different reasons to use this. Maybe one is trauma reprocessing, so you can actually have some more access to the patient. But again, very different than a microdose. So we can get to subperceptual, we can get kind of psycholytic where we're still somewhat in the room, and then we can get sort of full dissociative effects. And then again, with ketamine, we can go full anesthetic, which is not what we're doing here. But just kind of to give you an example of the different ranges of dosages of ketamine and what that can look like. So low dose ketamine is not microdosing. Um, Clinical ketamine produces this perceptual or perceptible altered state. It's medically supervised and has an evidence base. So the dose is higher, and the experience is part of the mechanism. So I would say the research on microdosing is ongoing and worth following, but it is categorically different from the clinically supported psychedelic assisted therapy that we're offering through Journey Clinical.
That's really helpful. Thanks, Sam. Gwen, do you get this question? And if so, what do you have anything to add?
I think it's really important to, as you just very clearly did, Sam, distinguish between microdosing and low dose, or what's called psycholytic doses. There are other companies out there that are advertising specifically microdosing with ketamine, and the dosages are all over the place. So I think that's really, really helpful to recognize more of what is happening. And I am a proponent of low dose psycholytic ketamine work with therapy, specifically with EMDR. That is a very different approach, definition, and dosage than microdosing. And I'll just additionally add regarding low dose psycholytic ketamine assisted psychotherapy, especially if you're coupling it with a modality like EMDR, which I'll just briefly explain is an evidence-based sort of mind-body approach for working with trauma, and does require more interaction, certainly, than a full dose journey, where again, it's an inward experience. Having a much lower dosage, just to throw some numbers out there, and again, it's fine print, different for every person, speak to your medical provider. But just for context, because I do get this question often, a typical low dose psycholytic dose might be 50 milligrams, 50, versus 450 or 500 milligrams for a full dose journey. Again, generally speaking, but just to give you some context, it's a fraction of a full dose. So you are able to then engage and interact in a session, in a therapy session, because it's so low, and you're still benefiting from the medicine, where you're receiving the softening, especially if anyone is familiar with parts work, right? These rigid parts that are really holding on to these old stories or rigid frameworks of thinking. This is a way to really help coax and facilitate the process, especially when coupling it with something like EMDR. And I'm seeing sometimes months of therapy in a handful of sessions. So I think it's a really amazing way to make this work accessible, both time, money, investment, and the work itself. It's work that you're doing. It's not the medicine doing the work, it's you. And so ways that we can enhance in all facets of the process are, as Miriam mentioned too, really being worked on and researched. And this is one.
Thank you both for clarifying all of that. The next question is very important, which is about eligibility. So, Sam, if you could share a little bit about who is a good candidate, specifically maybe for ketamine-assisted psychotherapy, since that's what's available today, and who would be explicitly not a good fit.
Mhm. Yeah, so the breadth of mental health conditions that we can actually work with ketamine is pretty large. There's a few rule-outs, but the most robust research with ketamine has been on depression and treatment-resistant depression. And so that's just where we've kind of started the research, but we've started to learn that it can be helpful for anxiety disorders, including OCD, PTSD. It can be helpful in some contexts for eating disorders. It can be used for really pretty much any kind of mental health diagnosis that comes up other than psychotic disorders. So people who experience psychosis. And I do like to bring up the topic of bipolar disorder because sometimes people either think that this they can't use it or can't access ketamine with bipolar disorder. That's not necessarily true. It can be. We just need to make sure that the patient is stable on their medication because ketamine can worsen a manic or hypomanic episode. So if somebody has bipolar disorder with mania or hypomania, we just need to do a really thorough medical evaluation and make sure that the patient is stabilized. And in some cases, we can work with bipolar disorder, but other contraindications to ketamine would be certain cardiac conditions. Ketamine actually increases heart rate and blood pressure and opens our airways. It's a bronchodilator, which is really cool because other anesthesia drugs actually do the opposite, where they have to be monitored in a hospital facility, which is actually why we can use ketamine in this way and mail it to our clients, and they can take it with their therapists or in the comfort of their home because it increases those things. But with that, we also have to take a look at the cardiac system and just make sure that we're not increasing heart rate and blood pressure to a point which would be unsafe for somebody. So again, if someone has uncontrolled hypertension, we would want them to see their primary and potentially get that treated. And what's really great about this is if we're not sure, we can do an assessment and see. So the intake process exists so that we can ensure the utmost safety for patients. And so we do a full psychiatric evaluation. All that really means is we just ask you all about your mental health history. We'll talk through any hospitalizations if that comes up, if there's suicidality, which ketamine also is really helpful for suicidal ideation too. We just need to assess the safety and whether this modality is right now. But ketamine is used in emergency departments for suicidality. People can get infusions. So again, naming how widely this medicine can be used for different mental health disorders. So thank you.
You're muted.
Yeah. Thank you so much, Sam. That's really, really helpful. And I want to offer also to Gwen, when you're discussing this with clients, what clients have you seen in your practice that have been a good fit for CAP and been good candidates?
So I really view everything through the lens of trauma. And I think people get maybe a little stuck on the acronym of PTSD and or even just the idea of trauma, thinking it needs to be this big, dramatic, kind of specific thing. And I will refer to Dr. Gabor Mate with his definition that really resonates with me and with many people I've spoken to about this, recognizing that trauma is what happened inside of us in response. And so when we frame it that way, we can then look at what's getting in the way of you being the person you want to be, maneuvering in the world. And so then we can kind of take another step in recognizing, oh, this can help with that. And as you started to kind of go on and on, Sam, around the many different aspects of treatment it can be used for, we see that, okay, a lot of the ways in which whatever I'm dealing with, diagnosis aside, is something that this can help soften rigidity around. This treatment can help soften rigidity around, rumination, or whether that's OCD or just a negative limiting belief, or a specific traumatic experience, right? Even if it's not falling into a category that perhaps this person may have taken themselves off of the list to be relevant to. So I think it's a lot wider, in different wording. Just I'll reiterate, it's a lot wider of a spectrum of applicability that people, I hope, seek and share and practice vulnerability in expressing what they're dealing with, because I think that this could help a lot more people than they think.
Mm. Thank you, Gwen, for that. And just to reiterate, right, this eligibility question, it's up to the medical prescriber whether you're eligible. And so the first step of getting treatment is that eligibility assessment. And it's their job to be able to ask you the right questions and really understand if you would be a good fit and if this would be safe for you. So I'm going to skip past, we already answered about the SSRI question. So I think that we have the information we need there. I want to dive a little bit more into specifically the CAP process. So when we talk about CAP, we mean ketamine-assisted psychotherapy. And this is the first kind of pathway to accessing ketamine treatment that Journey Clinical offered. And as Gwen mentioned, there's the use of a kind of lower dose ketamine, but there's also a full dissociative dose, which is that inward journey with an eye mask and headphones. And so I want to talk about what that looks like. Gwen, if we could hear from you, this series of preparation, dosing, and integration sessions. And if you could just share a bit about what it looks like when you have a client who you refer to the medical team and is a good fit for CAP, and what that process looks like.
Absolutely. So the bookends that are very important to honor are the preparation, as you mentioned, prior and leading up to the experience, the journey itself, which again, I'll reiterate, is really facilitating and cultivating a relationship with the medicine, with yourself, and with your providers. So this is a collaborative care model, being able to trust and really build that confidence and competence within yourself is really important. And part of that happens with the therapist, with the medical provider. And so specifically 3 to 5 sessions of preparation to not only identify your intention, which I'm putting it in air quotes because it's now a very popular term, which again, unfortunately, can also kind of muddle the definition of what really is that and how does it apply to me and this process. So yes, we go over identifying what we want out of this experience. Also, I take my time with my clients to explore what happens if you don't get what you want, or you don't get what you think you want, and really kind of going over all of those scenarios or possibilities. I really want to make sure as much as possible that clients feel clear about what's happening to their brain and understanding the medicine as we just did today, so that we can reiterate all of the different ways in which to, again, cultivate a relationship with the medicine so that they're coming into the journey as confident and competent as possible. So that then what can't be controlled, which is pretty much a whole lot more in the experience itself, because what's going to come up is going to come up. But if you've built a relationship and confidence within yourself and your team, what's most important is you trusting that you can handle whatever is going to come up, and not worrying about figuring it out and getting all over intellectualized about it, because the other bookend, integration, is really how we make sense of what happened and really process that out, tease that out, pull the gems and pearls of wisdom that were unearthed, and then also implement all of that into your day-to-day. Because as you had mentioned in the very beginning, Lizzie, that window of neuroplasticity, your brain is like a little kid, right? Their brains are sponges, as we call them. It's so receptive and ready for whatever you're going to give it. If you give it more not good things, it's going to reinforce the not good things. If you use that time afterward to integrate, right? And even define and redefine what that means to you, then you're reinforcing all the ways that you are wanting to reach and work toward building in your life.
Amazing, Gwen. Thank you for emphasizing that so much. We love to say that it's, yeah, the real work happens in integration. Miriam, do you have something to add? You seem very excited.
I wanted to ask and jump in and ask Gwen, because I think this is a really important point that you brought up around the fact that psychedelics there is a neutrality to them. They
Yes.
amplify the content that is already present in your patterns and your emotions and your thoughts. And I am curious how you talk about it with your clients and in how you work with that, because I think sometimes there is this myth of either, psychedelics are going to help me, they're going to change my life, or the reverse. I am terrified. Psychedelics are so dangerous. And I think it's important to introduce this notion of neutrality, that they're amplifiers and they work with you. And so I'm curious. I want to just like double down on this.
Yeah,
And
absolutely.
if you could share more.
Yeah, thank you for highlighting that. I took the phrase from Dr. Manesh Gurn. Everyone type in the psychedelic scientist, Dr. Manesh Gurn. He coined, at least the first time I heard, neuroplasticity is neutral, the neutrality that you're speaking about. And so it both gives us the responsibility, but also takes away some of the misconception around what's happening. Because again, if you give it more shit, you're going to do more shit, right? Excuse me. But if you focus and practice in the thoughts and behaviors you're wanting to cultivate, and all of that has already begun prior to ever introducing the medicine, by the way, because preparation, right? Then you're truly, in my opinion, and professional recommendation of engaging with this medicine, you are honoring the medicine as an ally. It's working with you. So recognizing it doesn't want to do one thing or the other. It's neutral. It's going to mirror the way in which you engage with it. And so I think that's also why I keep going back to it as a relationship, because if you're planting those seeds in the beginning, then the outcome already is going in that direction. And so the neutrality is, again, going in that direction. And so part of what that looks like more concretely is in integration. And even at the end of a journey session, arming yourself with as many outlets as possible to write, to draw, to create art in whatever way, to listen, to consume in whatever way, as many ways as possible, in the direction of what feels nourishing. So what you're listening to, not just music, but what you're listening to on any device, on any platform, in conversations with whom you're interacting, the people you surround yourself with, right? The food you eat, all of the ways in which you're consuming, right? Keeping that through line of intention into integration is how you can make the most of this neutrality and help it work for you. Does that help? Yeah. Okay.
Gwen. I'm going to shift our gears for a second. So we've been talking about ketamine-assisted psychotherapy. We just understood that has 3 phases: preparation, dosing, and integration, and that you have this inward journey in the dosing session. We also offer SPRAVATO at Journey Clinical. So Sam, could you give us a brief overview of what SPRAVATO is? And I know it's a little bit more narrow as to who is eligible. So could you just share about that as well?
Yes. So I think we mentioned this at the beginning. I think Miriam did. Spravato is a different derivative of ketamine. So very similar, but it has a slight difference. So, but it works in similar ways. So Spravato is actually a nasal spray of S-ketamine. And so it follows a specific protocol because it actually is FDA approved. So the amazing thing is that insurance is actually covering this for some people. The key piece there's two diagnoses that are currently approved, which is treatment-resistant depression. So people who have failed at least two medication trials of an antidepressant. And are still really struggling, and major depressive disorder with suicidal ideation. So those are the two currently approved diagnoses that we can get covered with Spravato. Another different piece is that this is actually delivered in a clinical setting. So we can't do it virtually. It does need to be in office. And it's slightly different because it's under observation by the medical provider. So in the CAP process, you're working with your therapist and your medical providers. We're checking your vital signs in the background, but in this context, you're in the space with the medical provider. If you're curious about it, if you've tried two different antidepressants without adequate response or have this, excuse me, have major depressive disorder with suicidal ideation, definitely ask us about this because it's covered and it's a really great option for people and creating more access. So I think Will is going to give us some info on how to find a local clinic here at some point too.
Yes, absolutely. We're going to transition right over to Will now, who first, speaking of insurance coverage, we have Spravato covered by insurance. Also, a large portion of ketamine-assisted psychotherapy can also be covered by insurance. So, Will, could you walk us through overall cost and how to get the information? I know the cost is a little dependent on some factors.
Yeah, absolutely. And Lizzie, if you want to go to our Journey Clinical website, because honestly, the easiest way for everyone to understand what their costs will be for treatment is to go to our website. And we actually build some really great resources for all of you to use to really figure out what that cost is for yourself. Let me first talk about Spravato just because it is pretty straightforward. So as Sam said, since Spravato is fully FDA approved, that does mean it is eligible for full insurance coverage. And sessions can be as low as a $10 copay per session with full insurance coverage. And the great thing about Spravato is that the Spravato team also has a bunch of resources available for patients. So even if you do have a deductible that you have to meet before treatment is covered, many times patients are able to get support into paying towards that deductible, which can make Spravato extremely cost effective for many patients if they are eligible, as Sam said, with an eligible diagnosis of major depressive disorder with suicidal ideation and treatment-resistant depression, which again is just a inadequate response to two or more antidepressants. And if you go to our pricing tab on the website, Lizzie, this is really the best resource that you all can use to figure out what the cost of ketamine-assisted psychotherapy treatment is, as it is a bit more complicated than that of Spravato because it's not eligible for full insurance coverage, but it is eligible for partial insurance coverage. So you can come to this page, journeyclinical.com/pricing. And then once you're here, you'll be able to add click some buttons. If you do have insurance, you can click that. You can choose your how many sessions you'd like to do. We'll stick with the starter for right now. And it gives you a detailed breakdown of not only what the total cost is, but exactly what you are paying for at each point of treatment. So again, you will start by having that initial intake appointment, which is fully eligible for insurance coverage. And then separately, you'll pay for the medication and processing, which is not eligible for insurance coverage. And then you'll also pay for separately the therapy aspect. So these are the sessions, those preparation, dosing, and integration sessions with your therapist. And it's all outlined very clearly in this calculator. So when anyone gets the chance to look into this pricing, you can go to this page and figure out exactly what ketamine-assisted psychotherapy will cost for you.
Very, very helpful. So I put that tool in the chat. And then, Will, could you also want to go back to the homepage? Could you
Yeah.
explain how to navigate this website for folks here who may want to experience treatment, both for Spravato, but then also for CAP?
Absolutely. So again, everyone can go to journeyclinical.com and that'll kind of be your home base for where to get started. We'll start with Spravato again, just because it is a bit more straightforward. So if you click on the Find Care tab in the top nav bar, and you click Spravato, then you get taken to this page where we include a lot of helpful information for those who are wanting to learn more. What are the eligible diagnoses? How much does it cost? What is the timeline for treatment? What does it look like to go into those sessions? And then some real stories from Spravato patients. But once you are ready, you can pretty easily find a treatment center. We have a treatment center directory at the bottom of the page, so you can filter by your state um, in the top left corner of this. Choose your state and also choose your insurance, and you'll be able to find a treatment center um, that is near you. As you can see, in New York, we have quite a few centers up and running and ready to see patients. So if you are interested in a center, Lizzie, if you don't mind just clicking on Casa Wellness at Sandoval Colab, all you have to do is click that and then click this interest form, fill out a few details for our team, and then we'll make sure to get in contact with you for next steps to make sure you can schedule that initial appointment. Um, if you don't see a Spravato location close to you, you have two options. The first is to just click this button, not seeing a treatment center in your area. That'll direct you to another quick form that you can fill out, and that'll tell us exactly where we should open up our next treatment center.
Great.
And then the
Amazing.
second option, if you don't see a treatment center, is to really just explore CAP. So if Spravato might not be the best fit, while we're still working to expand our site locations, as it does have to be in person, like Sam said, you can obviously explore CAP or explore therapy with one of our CAP trained therapists. So in order to do that, just go back to our homepage at journeyclinical.com. The quickest way to get started with care is to just click that purple Get Started button. And when you click this button, it'll take you to another quick form that you'll fill out. It'll just ask you a few questions about yourself. And then at the end of this form, you'll be able to create a Journey Clinical Patient Portal where you'll then be able to schedule your initial intake appointment with one of our providers like Sam, where you determine your eligibility and then get matched with a Journey Clinical therapist. If you'd like to, take a little bit more time, maybe just learn more about the process, meet with a therapist who's doing this work to get really comfortable with it before having that initial intake appointment with a member of our medical team, the second option that we have available is to click this Find a Therapist button. So many patients like to really meet with the provider that they're going to be doing most of the work with. So you come here, and then let's say you're from California. We give you the option to enter in your zip code and also do some more filtering on the directory. So let's say, Lizzie, you put in 94111. And then look at that there. We get to select Gwen as our very own ketamine-assisted psychotherapy therapist. And so you can click on her profile, read a little bit more about Gwen, the insurances that she accepts, where she's licensed in, any specialties. And then once you are ready to meet with a therapist, you can just click that purple Get a Free Consultation button. And once you click that, you'll again just enter in your contact information, click request, and that will send Gwen a notification that she has a potential client waiting, and then she will reach out to you in order to coordinate a free consultation. So all of our therapists offer 15-minute free consultations where you'll be able to meet with them, discuss your goals and intentions for treatment, and just make sure that you are a good fit together. It's super important for us that patients can find a therapist that they really connect with because they are spending so much time with them and trusting them with their healing journey. So we lay out all of these options just to make it as easy as possible and for you to be able to choose your own path and whatever feels right to get started with, whether it be ketamine-assisted psychotherapy, Spravato-assisted psychotherapy, or just psychedelic treatment in general. So feel free to ask any questions in the chat if anything's confusing about that process. We want to make sure that you all can get access to this care that you're looking for.
Thank you so much, Will. This is really helpful, especially navigating that website. There's so many resources for you all on that website. We also have a fantastic blog that has all these research articles and information for really frequently asked questions. Some of the questions that got submitted today, actually, there are corresponding blogs to answer those questions. So we will send out a summary with some of those links so that you can find that. I'm also going to pop in the chat the link to that directory that we just walked through. This is really exciting. You can now find somebody near you who is trained to deliver this treatment for you. And you can even get to know that therapist first before deciding that you want to pursue CAP, right? You can start to build that relationship if they have availability in their practice for regular therapy. And that can be really a great way to get into this as well. And then just to clarify that if you do decide you would want to experience ketamine-assisted psychotherapy, that therapist would then refer you back to Journey Clinical for the medical intake appointment. That always happens with a medical professional at Journey Clinical. And so no matter if you get started with that kind of eligibility assessment, the quiz that Will showed you, or if you start by talking to a therapist, you will have to do that eligibility assessment, coming full circle back to Miriam's emphasis on you must be eligible for the treatment. And we really want to make sure that every patient who's accessing this, it is safe for them to do so. So that is very important to stress. We don't have a ton of time. We're actually already over in terms of Q&A, but we did have some wonderful questions submitted. We have folks who are still hanging out here. I want to respect our panelists' time. I want to thank you all so much for all of the clarification and reflection and insight that you shared into these pieces. I also want to offer just to any of you, if you have any closing thoughts or reflections, and then just for everyone else to know, again, just look out for a follow-up email with some resources from us. And we really hope that this evening was clarifying for you and invited you into curiosity for either yourself or what always strikes me about community events, whether we host virtual or in-person events, is how many folks show up, not just for themselves, but to advocate for someone that they love who may be curious about treatment. So I know that a few folks are here today for that purpose as well. So I want to mention that. Any final words from any of our wonderful panelists? Thank you again.
Yeah, just curiosity. Oh, go ahead, Sam. Just following that curiosity for whatever led you here, find a nugget and keep going. And if anyone wants to reach out to me directly to follow up on any other questions, I'm connect@gwenpelfini.com. So however you can find me, it's really just my name. And I'm happy to talk about all of this. So follow the curiosity to whatever feels most resonant for you.
Yeah, and I just wanted to say thank you all so much for joining us this evening. Like I mentioned at the beginning, this work impacted my life, and that's why I want to share it with all of you. And I always like to say nobody needs fixing. We all just need help untangling and being made whole again. And we as a team are here to support each one of you in your journey, whatever that looks like. So please reach out and ask all the questions. We're here for you.
Absolutely. That's such a great sentiment, Sam. And if anyone does have questions, lingering questions, I know we weren't able to get to the Q&A tonight, and we want to be respectful of all of your time. But please reach out to us at patient-experience@journey.clinic. I just sent that email in the chat. If you have any questions or just want to connect with our team, feel free to send us an email there. That goes directly to me. So I'll be able to answer your questions. We can talk about anything that might come up and just help you get started with getting the treatment that you deserve.
I feel like I need to say something too. Everybody said a closing word. I'm so grateful. I'm so grateful to anyone who has taken the time to join the conversation, to be open, to learn, to educate. I think this is a movement and this is a field that is evolving so quickly. We have new information, every month at this point. And what we want to do at Journey Clinical is really make sure that we give you education, that we give you access to information so that you can make informed decision about your own treatment options. And so I'm very happy that this exists and this can help. And if it's right for you, then this gives a lot of hope.
Well, thank you so much. Thank you to you all. Thanks to everyone for still being here, and we look forward to being in touch. I'll reiterate patient-experience@journey.clinic. Very proud of everyone at Journey Clinical who works to really give that care to folks who are reaching out and attention. So if you send an email to that inbox, you will be supported in exploring your options. Thank you, everyone, for joining, and we'll see you soon.